Hey, Claire.
Morning.
Good morning, everyone. Claire, do you want to give the idea for the agenda today, or?
Yeah, so the thought was we would convene that small group of folks that are familiar with preparing the application. And then just take some time to hash stuff out and look at what we have prepared, starting with the new questions that haven't been in the application before.
Who's all, I don't see that there's that many on this call. Anyway, does that seem like a good idea, or are there other things that this group would like to discuss before we get into some of the specific NOFA questions that need to be answered? Wendy, Steve, anybody have any thoughts on that? Using this time to answer specific NOFA questions, or?
I think that makes sense. If we could, like, wordsmithing in a big group though is always really hard. So maybe if afterwards we could get a link to look at things or something.
It was in the calendar invite.
Well, that shows how much I pay attention, Claire. I'm sorry.
Steve, what are your thoughts on that?
Yeah, I mean, I'd just soon address any questions, direct questions that Claire and others have, rather than, yeah, let's start there. I mean, I glanced through this document, but haven't had time to nitpick it.
Yeah, and I think it's good, like, we can go through it, Claire. I think it's a good idea, and then like things that need more attention, then we can send that out too for more, some things that might need more thought.
Yeah, everything that we had questions on, we put in the comments, like sidebar here.
Okay.
Yeah, and then I have like a note section so you can get an idea of who I'm following up with at the end of this. So
So do you want to go over some specific questions then, Claire?
sure. Yeah, so I'll start with Melissa's COVID response questions, since those are brand new. And she couldn't make it today because she's out of town. So I'm recording this for her so she can take a look at this. So she and Raphael and Nick tomorrow consulted with each other to answer these questions. So if you could just take a look at this question about safety protocols. She just wanted to know if she was directly addressing protocols enough in the response here.
I think the answer to her,
Go
I
ahead.
think the answer to her question is, yeah, we need to, if there are protocols, we need to at least identify them, or put a document title on them, or attach something. You know, they're looking for a formal, you know.
Right, like it's HUD, like if this occurs, this happens, and that
Right.
that equals this.
Bingo.
Do we have that?
I mean, we have it in the way that it's kind of written here, but I think we need to write it more like, if someone is symptomatic, you know, shelters contact, specific health department contact, who institutes testing, and then within 5 hours or whatever, client is moved to the
So you think that
isolation
we
facility.
we should create protocols?
I mean, I think we have them, they just aren't written down.
Okay, Okay,
You know
Well,
what I mean?
actually, they kind of are. They have the, we did that one for the shelter task force.
Oh, yeah.
And then the county also required a part of the emergency management plan.
Right.
so that would be good to put in there what the shelter task force did, right? If the shelter task force created a
Yeah,
document to just attach that.
Wendy did a great one, and I've been,
Trying to remember. I think,
I use it all the time.
do you have it? Can you send it to me?
Yeah.
And Claire
Yeah,
probably needs it.
Yeah, I'll send that to you guys. I mean, it's old. I mean, it's almost 2 years old now, but
That's insane.
Is
why
that
are we
all?
attaching it? Sorry, I had to step away. Just a second.
It's the protocols, the shelter protocols developed by the shelter task force.
I'm confused. Why wouldn't we just talk about that in the narrative response?
well, you could.
You could. There's just
Yes.
language. There's already language created about what the actual procedures are.
I think what we're just kind of saying is making this response look more like actual protocols versus like a narrative response.
Mhm.
Because you know how HUD gets, like, if we don't say 100% of the county is covered.
Yeah, they want you to actually like regurgitate the question back.
And then, the county had that. Yeah, I'll stop there. But I mean, it had that form and part of the safety plan. And
Luke, are you on the meeting? Yeah, he is.
Yeah, I am just
You
multitasking. a
you
little.
have that language?
I don't have like a protocol thing like what you guys are all talking about. Here's the thing I typed up, with you.
Yeah, but they said the Office of Emergency Management had protocols. Were we ever
Oh,
privy to
yeah, I'm
any of
sure.
that? Or could
I
we
can
get that?
ask- It's like, let me think about how to get to it. Because it's all in like a database. But I do have access to it. I haven't been there for like a year.
Yeah, see if they have actual like emergency management protocol.
Yeah, let me poke around for a minute, see if I
Okay.
can just
All
pull
right.
it up.
And then it's probably all the language that is needed is probably there.
well, the thing that I was thinking, that I was referring to was that attached to the emergency management plan for all the shelters and funded agencies, we had to do a separate one in reference to COVID protocol for the shelter, for my home, for, I don't think any of that was ever submitted anywhere, but we've got them. And there was
Yeah.
a template for it.
So like all the county contracts had protocol. Yeah, yeah. And that would be Luke too. Okay, well, we'll look for that. I think it's there. I think it's just that we'll keep looking and then send you what we can find.
And then obviously we don't have a ton of transitional housing providers in the COC. My understanding is they're following the same recommendations that others are. I know that CVI did quite a bit of coordination to make their transitional housing facilities safer. So Melissa was looking for some support with that, but not sure if anyone knows more about that than I do.
I mean, you can say that information was communicated through the shelter task force.
Mhm. And then I had commented, like, maybe we could talk about like match how many were served in Clare Hall with how many were served in hotels. That's easy enough to get response to talking about protocols for addressing safety concerns within congregate emergency shelters. Cool. Just do that.
So are you thinking to get that information from HMIS?
Yeah, we have it. It comes
Okay.
from the caper.
Okay. So you don't need anything then?
No,
Okay.
just a comment. Okay, and then improved readiness for public health emergencies.
I think we could use that same county emergency management plan thing. I'll dig all that up and try and send it over.
So then if if the Milwaukee County Office of Emergency Management has all these protocols, then we should probably put that language into that collaboration. Because I see a lot of like the health department,
Mhm.
you know, and I don't know specifically who is doing what, but probably to make it look more cohesive, it's probably a good idea to put that in there as well, once we get that plan.
So enhancing,
You got it.
Discussion.
Yeah. Cause then it could, and then like put that, like emphasize it in the beginning, all the partnerships. Cause like the health department's mentioned down below, but maybe mention everybody. The collaboration is how we have improved readiness, one of the ways.
okay.
Do they want actual like specific things? How did we?
Well, I thought this was important. Like the funding coordination piece.
Yeah.
So we have stronger partnerships. You know, which sets us up pretty well for the next time there's a public health emergency. For making sure we're not duplicating efforts and we're using our resources wisely. Let's see.
Oh, yeah, we will be able to quickly ramp up existing plans. I would emphasize that more at the beginning.
I would stress too that the housing task force component of the civic response team included so many private foundations and funders outside of the governmental systems.
Great. Anything else? Okay. And then we talked about COC coordination to distribute ESG Cares Act, ESGCV funds. looking at safety measures, housing assistance, eviction prevention, healthcare supplies, and sanitary supplies.
Can you go up again, Claire?
Sure.
Coordinated recipients.
Did you want to bring up the state CV money too?
Yes. Let me see. Where is that at? Okay.
I mean, it's just an idea.
Can I scroll down so you all can see everything?
I mean, you can make the direct connection between COC membership, us distributing rental assistance directly, and
Like we are here.
yeah, and 3.
So what are you thinking I should expound on?
Like community advocates as a COC member was also responsible for being a conduit to all that eviction, all the rent assistance money that flowed through.
And I might even put a total number in there just because there's been so much trouble nationally distributing those funds.
The thing that I get stuck on though is that when I listen to that webinar, they say that
Yeah.
they made the specific comment. They want to know what the COC is doing. They wanted to know what the COC was doing. They want not what the programs of the COC are doing. So, and to me, I think that this needs to, and I don't know what all happened, but I would say like overall, when I'm reading this, it's something needs to be amped up because it's a lot of money,
Mhm.
but I don't have the specifics of what it should say. Cause you're right, like the rent assistance and what happened with all the rent assistance that was funded is now we're seeing kind of as national leaders on that because so many other municipalities and communities weren't able to spend it. But I'm not quite sure how to do that in a way that they want to hear it.
Couldn't we put into context that we had those planning discussions at COC leadership, which covered ESG CV allocations and allocations from the state? I mean, there's more to flesh out, obviously, but
Because go back to the question, Claire. Coordinated. They want to know coordinated. Okay. So yeah, I think that's what you would want to say. But I also agree with like Steve and Wendy to make it sound that the output of this was lots of productive spending of the funds, if at all possible.
You could also say at leadership early on, we talked about the community case managers and that got funded through the CV and the whole hotel strategy.
mhm. Yeah,
And
I was,
that's all CCY too.
yeah, my feedback to Melissa for point 2 for housing assistance was to talk about community case management, expanded rapid rehousing
Mhm.
capacity.
So with this question, we can talk about either CARES and or CV ESG dollars, correct?
You want to go back? No, it says ESG CARES Act.
So nothing else besides ESG.
Take a look.
Because that then we're just talking about the 4.7 million. Yeah, okay.
Well, in that case, you could almost make a point that we leverage ESG funds with other rent assistance funds. And
Mm-hmm. Yeah. And if you want to put numbers behind it, I know, Steve, that you guys did a bulk or used a bulk of the ESG CV for rental assistance. And I don't know if we want to put numbers behind that or just Mhm.
So just to update on what I'm finding here, we might need to reach out to somebody from Office of Emergency Management for the protocols everybody was asking for. The only things I'm noticing are like, I've got some MOUs and some waivers for different documents that we're allowing people to self-certify for certain things. But all the other emergency management stuff I have is like, I don't know how to say it, like kind of in the weeds of our work, like what we had to report if people got sick at the county, but nothing about partners. So I don't know who the best person is to reach out. Claire, you just emailed me that you're talking to somebody from there.
Mhm.
I don't know who the best person is to get, like, just send us the document. I'm sure they'd be able to find it pretty quick.
and I can
Yeah.
talk to the emergency office in Madison. I mean, they have a bunch of stuff, but are we looking for more local, like through the health department?
That's what it was sounding like a minute ago when we were
Yeah,
talking.
it sounds like the Office of Emergency Management, when we were talking before, Raphael, about protocols for emergency shelters. What at the time the shelter task force was developing protocols, like almost 2 years ago now,
Mhm.
that the Office of Emergency Management for the county also had them.
Gotcha.
So that's what we were
Okay.
talking about, looking for to see what was in there. I can try to figure it out too.
Mhm.
Will we need copies of any of these like MOUs and waivers, or would we just write in the narrative that we have them?
I think at this point, right in the narrative that we have them.
Gotcha. Okay.
Is there anything else that we'd want to mention, like in the way of housing vouchers or anything else? In looking at, what's this comment here? Would it make sense to allude to hazard pay anywhere? In both item 2 or item 3?
I would maybe do it under safety measures, just acknowledging that, a 24-hour facility requires staff. Hazard pay and PPE were made available through these funds. Raphael, is there anything more to say in the way of healthcare or PPE supplies, sanitary supplies?
Maybe what we can do is, because I think early on we had, I'm not sure this is important or not, but we were able to get access to a PPE supplies through our health department. They played a significant role in us getting like especially masks during that time where we couldn't find them at the stores. But also we were able to order bulk PPE supplies through a special, Amazon set up a special account for government entities to access PPE supplies, whereas the general populations didn't necessarily have access to that site. And that was set up through, I believe, like the city of Milwaukee set up a kind of a tutorial and helped us set up these accounts. But we made sure we were able to at least order all the supplies and get them to the groups. Yeah, and I talked to Melissa about those hand washing stations the county did early on and put them in front of the shelters.
That's good. All right, I'll move on. Okay, they have a question about coordinating with mainstream health. So health department, city, Wisconsin DHS, local hospitals during the COVID-19 pandemic to decrease the spread of COVID-19 and ensure safety measures were implemented like social distancing, hand washing, sanitizing, or masks.
Did we mention anything about the National Guard in here? And Claire Hall? They play a significant role in this setup of Claire Hall in the beginning. Or we just add them as a partner here on top.
And did the hospitals have any partnership with Claire Hall about,
Steve Oley, is he independent or does he work still with 16th Street Community Health Center?
I think the health department hired him.
Okay, but he has no connection, I don't think, at that time with a hospital or institution.
so I would see too, if there was any, you know, what the connection was, and maybe coordinated entry knows this more, with like hospitals, you know, being able to discharge people to Claire Hall. I'm not sure how that all worked. I know it happened a couple times. I'm just not sure how it all happened.
I think, yeah, that was a question I was talking to Melissa with. Maybe we may need to connect with Emily Whitcomb from the county, because I
Yeah.
think she was working on that transition with hospitals to some of our hotels.
Did any of them assist with the, like, with testing, vaccination?
The whole fire department was doing testing at Claire Hall for everyone.
Yeah.
Then what happened if somebody tested positive in the, in shelter? Were there any, like, just the health department connection?
Yeah, we'd call Nick and he'd get them transferred over to Claire Hall right away, essentially.
Yeah.
If they were severe enough or they had some really strong symptoms, I think they were transferred directly to the hospital.
So I think we need to talk to the health department and see how that all
Mhm.
works. Because I mean, that's really, I think, key.
Sounds good.
Claire, can you just make a note to connect? I think Nick will have some additional insight into this question that he can help us with, because I know he was in constant, obviously, communications with our local hospitals. And also to talk to Emily from the county.
Okay.
I mean, did they like give out masks or hand sanitizers, or did they do any like that healthcare partnerships? Did they?
Yeah, that was tricky because we had access to a lot of those supplies, so we didn't. And at that time, hospitals were also struggling. I actually gave some of these N95 masks that we had early on to a hospital because they were running short. So it was.
So that in of itself was a coordination, right? So then
Yeah.
if like we had more, then we had communications and
Mhm.
help to you know, share supplies or whatever kind of language you want to develop around that.
Yeah,
There were communications about it then. So
Yes, they
I
were-
think
yeah.
that's what you want to like emphasize.
No,
Nothing with the medical college?
I mean, I know that they did COVID-19 testing. I remember sending something out on the listserv about it, or to COC leadership or something along those lines.
I mean, we're a part of that task force group, the civic.
Mhm.
And did anything result out of that, Wendy?
As far as the medical college being a part of it.
Well, anything that like reduced the spread?
I mean, they were just, I feel like that group was really overall supportive of like everything the COC was trying to plan and like just trying to fill in the holes where they were. So like, I don't know that they were necessarily coming up with like overarching strategies, but they were like, oh, you need more staff people, here's some money for that, or that kind of thing, you know?
Yeah.
So one thing that jumps out to me in looking at this is the state health agency connection.
Yeah,
I don't
that
know
group.
super much about that.
Yeah, no, yeah, I served on, and still this group still meets. So this group is coordinated to the Wisconsin Emergency Support Function 16. And they've, over the last year and a half, as this group has kind of grown, but it's really the folks that are listed here are part of this weekly conversation. They talk a lot about coordination of funding and supplies. That's kind of their main focus of this group. So you have all the main players like FEMA, HUD, the State Homelessness Council, and all the COCs.
So are we answering the question how all these groups ensured safety measures were implemented? So like all of these players met, but how did they actually decrease the spread and ensure safety measures?
Yeah, I think we still need to highlight that in here.
And the thing is it like it happened, like right
Yeah.
from the very beginning, we had a meeting with the health department, and the health department is like, this is what we know so far, right? Everybody was like learning this together. So I think like that, I would try to like paint that picture a little bit more, right? Like nobody knew like from the very beginning, and they were like, yeah, this is going to be an issue, and let's talk about how what protocols we're going to have. So there were meetings about this. And as we learned about COVID and all these partners learned about COVID, we adjusted our protocols to make sure that we were stopping the spread. I would try to get that emphasized a little bit more.
Yeah.
But I mean, it happened. I mean, and we just have to like show that. All these groups resulted into a decrease of the spread, and we were discussing safety protocols during these meetings.
Mm-hmm. And I think since this group was a statewide collaborative effort, I just saw that there were parts of the state where there was more focus on because they didn't necessarily have the resources like Milwaukee and Madison.
Mm-hmm.
So this was a great group for like those rural communities that didn't necessarily have funding to pop up 3 hotels during this pandemic. So they were really assisting some of these more rural groups than like the Milwaukee Madison, but it was good for them it was good for us to just know what other communities were doing, but also they talked a lot about accessing like PPE, which we typically would have access to, and or other types of funding sources.
So these collaborations actually helped to mitigate the spread outside of our own community, even by sharing what our knowledge was.
Yep. And then from that group, we also did these, we started doing a couple months ago, these bi-weekly or monthly training webinars on best practices.
Yeah, like I think that's what they want us to see.
And that's
things actually happened as a result of all these meetings.
That's an outcome. I didn't think about this before, and I was talking to Melissa, but I think that can be a highlight of this, that from these conversations came a need for additional professional development, resource sharing across the state of Wisconsin.
With the focus of mitigating the spread.
There you go. Yep. I mean, Nick was a guest speaker for a lot of those webinars, just to talk about even how Milwaukee has been working to mitigate and deal with COVID.
Can we talk about the vaccination strategies?
No.
Talk about that.
Yeah. Yeah.
Yeah, that's huge. I mean, Claire Hall is one thing.
Well, and then they went out to all the shelters.
Correct.
We coordinated for our permanent supportive housing projects to have them come out and do the vaccinations.
And they're still doing all that and
Yeah.
testing in
Still
shelters.
doing that. This is so hard of a question to answer because I feel like
It
we're
is.
so in the moment, right? With
Yeah.
all the COVID stuff, all of us are.
Yep. And this can easily go above 2,000 characters with all this
Yeah,
stuff.
yeah, exactly. But I would really try to emphasize more of what actually the actions were of these groups than what the groups that met.
Yeah.
Right, Ed, this is Ashley. Like, we had our CMO go out on overnights and offer vaccines to individuals that were category 1.
Yeah.
So street homeless folks, yeah, there were collaborations with the street home, like yes.
I mean, when we talk about hospitals, as they use hospitals as an example, I mean, outreach is a clinic. I mean, they played a significant role in this process. I mean, that's a healthcare institution. I'm not sure if that's like, if we can.
Or say something about the federally qualified health
There you
centers
go.
in general.
Yes. Yes. Yeah. Mm-hmm.
And I think I think that the hospitals did refer folks to Claire Hall. I'm just not sure how that all happened. So to find that out.
Yeah, hospitals are still till today referring folks to our mini
And
Claire
now
Hall.
the
as
hotel,
outside.
right.
Mhm.
Okay. Right. Communicating information. Are we good on the last question? Sorry.
I think so. I think like once you talk to everybody and kind of flesh it out, if you want us to look at it again.
Okay. Communicating with homeless service providers. We talked about, I don't know, I would change this to committee meeting. And then our communication through listserv, social media, emails. Talking about coordination with the state to provide information about safety measures. So sort of repeating that for changing local restrictions, emphasizing that that information comes from the health department as well as the state. And then vaccine implementation. same.
You might be able to put a nugget in there about how Nick prioritized homeless populations for vaccine priority and gave him that direct link to the scheduling website.
Mhm.
I mean, that's how I got mine. So.
And then there was an advocacy push, like from us or all COCs to the state. There's a sign-on letter that was distributed, so we could bump up folks who are homeless and staff in homeless service agencies in the priority for the vaccine.
Yeah, that conversation was fairly frequent during that ESF 6 calls, weekly calls.
Anything else?
Has the COC talked to Nick about this yet?
Yeah.
Yeah, I'll reach out to him again just to, I think, give him a heads up to, we're gonna need some, if it's more input from him, at least some more guidance.
We put the. I mean, he was like at every meeting, right? For many, many months.
Yeah, I mean,
So I don't know. I'm just trying to think of like how to like, say how.
well, remember, he came to our initial meeting on last, March, I remember this day, March 12th, and gave an overview of COVID. And that's when kind of things started.
But like, at the provider advisory, he would.
Did we
Mhm.
say the health department assigned a direct contact that was available
I think that's.
instantly and solely
key.
to the COC or something along those
Yeah.
lines?
Yes, Wendy, you're exactly right.
Yeah, you can, yeah, I can remember, it actually, yeah, that happened the night before, March 11th. I called the commissioner and she assigned basically Nick to us on March 12th, and he's been with us ever since. because I wanted to get someone to come in and talk about COVID at our meeting. And then that's when she gave me Nick's number and I called him and he said, yeah, I'll be at your meeting tomorrow morning.
Got that note. Should we talk about anything like committee wise? Like CE leadership or anything like that for changing local restrictions?
Let me look at the question again. Please, sorry, I didn't mean to. And then, so what was your question, Claire?
Yeah, I'm just thinking about how like COVID planning, you know, might have played out in committees like CE leadership, shelter task force.
Like how that information trickled down?
Yeah,
Yeah. Yeah, I think that's important to know too. And I don't have the answer to that, how to answer that, but I think, yeah, making sure like that, the information was disseminated to all of the providers and the folks doing the direct service and.
mhm. And I can round up meeting minutes to kind of catch Melissa up on all that. Anything else? Right, 1D6 about identifying eligible persons experiencing homelessness for the COVID vaccine. Again, Melissa wanted to fill in the blank here about identifying folks who were staying in Clare Hall as eligible.
Well, the thing is I think at that point, the folks at Clare Hall were COVID positive, right?
Mhm.
So when did they decide, like, you know, you had to kind of wait to get vaccinated, right? You couldn't do it while you were like positive for COVID. And I forgot what, you know, they've kind of changed the guidance on that.
Mhm.
So I don't know if like that would have happened, but at the hotels and shelters, I remember it happening. I just don't remember. Like they coordinated those clinics, like the health department going in.
I'm skimming the question. Sorry.
It's about identifying them. How did we identify? How did, it's the identification of folks. So like when they come into shelter, how do we know if they're vaccinated or not? Do we ask? Do we know?
I don't think we were asking.
I know some of the shelters ask, some don't. We always ask if people want to be vaccinated, not whether or
Yeah.
not they are.
Yep.
And the health department sends someone over like immediately if anyone says yes.
Okay. So the shelters like ask, and then the local protocols that if there's interested folks, then the health department comes out immediately, right, Wendy?
And they give them the $100 now too, that like the city has as an incentive. They
Mm.
give that to the people in shelter too.
I think, yeah, then saying, okay. That's good to know. So was it at first that the collaboration with the health department was that anybody experiencing category 1 homeless, street or shelter homeless was prioritized within the health department to get vaccinated right away? Like the initial push? And then kind of to stop, like say how we're continuing to do it.
Sounds good. We're continuing to do this by educating folks on the vaccine, informing them of incentives. Should we talk about that there's a mechanism for helping folks like look up if they've been vaccinated or not?
Oh, the Wisconsin registry, vaccine registry.
Mm-hmm.
Does that happen? I think it's a good idea. If they're actually like, look, like if that's been like put out there to like look to see if you've been vaccinated.
Yeah.
I think it's been shared with shelter staff. I don't know how much anyone does it, but
Yeah.
So it's kind of it's a standard question. So is it a standard question, Wendy, to say, are you vaccinated? And if you're not vaccinated, are you interested in it? Is that a standard question from the shelters?
I think everyone is asking that. Yeah.
Okay. Do you ever talk about it at the shelter task force?
I feel like we've talked about everything COVID so many times in so many ways. I don't even know if that specific thing came up or not, probably.
that it's a, yeah, you could say that that's part of the protocol now of shelters when somebody comes in to ask if they're vaccinated, and then to
Mhm.
say if they're not, then they're offered a vaccination.
Okay,
This
so
is
that
quite-
happens at shelter intake, not at CE intake.
I don't know.
Yeah, because
Yeah.
I know we had talked about that, but it was a long time ago.
It might happen both too,
Right,
honestly.
right.
I don't
So
know.
we could find out if it's happening at coordinated entry, but just because
Mhm.
this question's really about identifying. Like, how do we know?
Okay. This might be a good spot for the actual like street outreach. Preventing vaccination through there, through an FQHC.
Right, like the outreach attempts to have, yeah. Mhm.
Mhm.
Like they're asking their.
Okay. Anything else? Okay. Increases in DV. And I believe Liz has been in touch, or sorry, Melissa has been in touch with Liz for this question. Hmm. I just realized that the 24/7 text line that Sojourner has, I think that started early 2021. Information about that was provided in COC leadership and then over on the listserv.
I'll ask about our crisis line, but this is where staff turnover comes into play, you know.
What do you mean by that?
Like the people who were monitoring and collecting the data may not necessarily be there anymore. I'm not
Mhm.
sure where that all is, but I'll ask.
So yeah, I would say that it says how your COC addressed.
Mhm. Additional resources were awarded to Sojourner Family Peace Center and the Women's Center for their shelter operations.
Well, I don't know, do you think this question's asking about I don't know if they're asking about the COVID stuff in here.
No, they're not.
So I don't know if I would put that in there.
No, but I'm saying, like, we made sure that we still had shelters available, or we, worked towards that by providing resources to keep them operational.
Yeah, I think like that's kind of what this question is
Yeah.
asking. Like, what did the COC do? So was there like, was CARES Act money prioritized? Were there like additional collaborations made, like with the, because they all say Milwaukee had a huge increase in domestic violence during this. So like how did the COC respond? So was this was the COC part of any kind of like collaboration with domestic violence? Office, within the city, they have the Office of Violence Prevention. Did they ever talk to the COC about it? And the increases of domestic violence in our city? I don't know. I'm just throwing stuff out there because I don't really. And then Steve, from a DV perspective, can you think of anything like the COC did for domestic violence?
Not as separate from regular homeless.
Emily.
What about if it was like, because they were talking about like increased unemployment, like a lot, like everybody's stress was high. So what did we, was there any kind of like collaboration with like a parent hotline, because everybody's kids were home, to like decrease stress that way? Like, was there any kind of prioritization if somebody experienced DV for any of the eviction prevention or anything like that? I'm just thinking out loud. So if anybody can think, because I don't.
This is hard to do a cause and effect because it's
This is a reach, but they're prioritized for shelter. So, but that's always been the case.
Shelter and rapid rehousing too,
Yeah.
like the programs.
I think getting Liz's perspective would probably be important at this point, because she could have something that she sees.
Okay. Okay. 1D8.
That's right there. Emily Kenny is the CE system expert. I see her name on the call.
Hi.
Expert.
I'm just reading and thinking.
I think, am I right about this, Emily? The navigation center was like one of the only places that was like open for people to go to.
That's true, right? At the height of
So,
COVID. At the
yeah.
beginning. Yeah.
I would definitely say that that was something that we should talk about.
And we expanded our hours as well. That's a good point, Jessica.
And then and then what else did coordinated entry do during COVID with all the rapid rehousing? Did we talk about that? Okay. Maybe emphasized, that quickly took on, prioritizing folks in other, funded programs.
Mhm. Did I talk about prevention at all? We did the same with prevention too. We started a prevention staffing. And we created a streamlined process between the ERA eviction prevention and coordinated entry if ERA, didn't work for some reason. They weren't eligible or. Can't believe I didn't say that. I can. It's hard to remember all the things you did,
Right.
That seems to be the theme of today's meeting.
I'm glad it's not just me.
Everybody
then.
was just doing for the last 2 years.
Yes.
Emily, we had we were talking a little bit about CE in a different question about identifying folks who have been vaccinated or who are eligible for the vaccine.
Okay.
Did that come up in CE assessment
Not
at all? Or
no.
no? Okay.
We had a request around that, and I said, well, we could ask, but so first of all, going off of just client report is as reliable as that is,
Mhm.
but then secondly, I have been pushing back around vaccines personally because I want to make sure that people are served kind of regardless of whether or not they're vaccinated, but certainly ramping up connection to testing. And that was another thing that we did. It was like connected with the health department for testing and safe emergency housing placement. But we haven't gotten so much into the vaccine world.
Okay. Sounds good. Anything else? Okay. So jumping here, just wanted to tackle like the highest weight questions first, or newest. So there's definitely more point weighting this year in coordination with public housing authorities. We're in a pretty good spot with that this year, obviously, because of HACM's homeless preference. And then that's on top of 2 other PHAs continuing to have a homeless admission preference. So just to provide some background, I've been going back and forth with Ken and Pooja for a while. So I'm waiting to get the admission percentage from Pooja. I'll follow up with her. Ken is working on it too. Their software is down, so he's trying to find a workaround through an alternative software. So we'll get that. HUD wasn't explicit about the moving on admissions being included in their like total percentage of homeless admissions. I believe there was an FY19 FAQ that said that that was okay. So I'm operating under the assumption that that's still the case, because they don't address that explicitly in this year's FAQs or in the detailed instructions. So one thing that I was a little concerned about was the like attachment that's required. HACM's like homeless admission in their admin plan, or their, I don't know what this acronym stands for, ACOP off the top of my head. It has a draft watermark attached to it still, even though like they had a board approved homeless admission preference. So I was a little bit worried about how HUD might run with that, and how they might interpret that like it's not final, therefore you are getting docked points. So Ken provided me with some board minutes, which aren't exactly in the list of eligible like material that you can include from a PHA. It's pretty much your policy or procedure, another written document like addressing policy and procedure, or a letter from the PHA speaking to that.
So this is what I'm gonna say, Claire, too. So it's that like, it sounds like we are worlds above other communities, right? Because it just says, describe the steps your COC has taken.
Right.
And then like the last thing you can say is like, our COC hasn't worked with any PHAs. So I think like saying what we did, and then what documentation that you have, and then maybe the board report with the draft version would probably be, I think it seems good to me. But I mean, definitely if somebody else has.
Okay.
Oh, can't we just take the watermark draft off?
Yeah.
No.
You could just put in like that, like ask for the board report where it says it was approved too.
Yeah, I've got it all.
Yeah.
So I just gotta like pull it off of eSnaps and then put it back together in the attachment with everything. So
I would just be really clear with what the steps were.
So if you'll scroll down here are the steps.
Oh, shoot. I do have to say, I have to go right away at 11:30.
Okay.
Do we want to schedule more frequent? Do we want another a NOFA work group meeting before you submit, or do you want to just like reach out?
Yeah, absolutely. Yeah. I'm going to be finishing up like a rough draft of the questions. I think there are like 12 or so that I still need to work on the application this week. So I don't, whatever is convenient, I'm fine with just kind of taking in comments on here. Like in the sidebar here, and then working off of that, and then I can reach out to folks if it's kind of hard to find a meeting time.
Because the next time we meet is November 8th.
Mhm.
So, I mean, that's up to the group. What do they think is the most useful? Is it useful to go through things like this via Zoom and talk it through, or you think just getting comments back and forth? Any thoughts?
I personally do better if I'm reviewing documents back and forth, like reading them.
Mhm.
But I'm happy to hop on when I can to Zoom.
Steve?
Mondays are fine with me. But if you do if we do a document review, if you could either highlight or make known what your questions are without reading through all the comments and everything on the side. So I could give you a direct, it'll just point my eyes.
Wendy?
And let us know when you send it rather than hiding in a meeting invite.
What Steve said, I'm the same.
So do you want to just go back and forth then, or do you want to meet? I'm trying to understand. So should we have another meeting like this, like go back and forth and have another meeting like this, or just go back and forth via email?
Maybe we go back and forth in the document, and then November 8th, just plan on catching any final
Okay,
confusion that people have. Does that make sense, Claire?
Mm,
or do you want to do a meeting? We could do a meeting before. I mean.
yeah, I think one more.
What date would work for you?
Take a look.
Because when do you want to submit this by?
November 11th.
All right. So do you want to do the 25th? If we did the 25th?
Yeah.
Oh, it's all right. Nobody's here. The big dog jumps up and then the little dog thinks that means somebody's here. That's not true. Right? So what does everybody think about the 25th? Like
That's
Emily,
fine.
is that fine?
Yep.
Okay. And then before I go, are there any like really big glaring things that we should talk about in person before? Claire?
Not that I can think of right off the top of my head.
Okay.
I guess like as far as the schedule, just a reminder that subcommittee panel for the board to just check on the renewal project scoring and score the narrative responses, and then our average will be added for a final score. They're meeting this afternoon with the city. And then as a reminder, like appeals, we'll receive those over email. So a form will go out with the like notification of accepting or rejecting an application. And then that committee will look over like that standard one-pager form if anybody needs to submit. And that'll be on the 15th. We'll just go over that. And then the special board meeting to approve the final ranking is next week, Monday, the 18th, just as a reminder.
So the special group is just reviewing the narratives? Is that what you said that we sent?
Yeah, or like they're just kind of giving like the renewal project scoring calculations that I have put together, like a once over too, just to make sure those look all good.
And then there's still provider advisory on Thursday, right?
Yes.
We have a plan. Do you want to go back to your question for the last 2 minutes or?
The PHA question.
Mhm.
Okay. We did a lot, so this kind of wrote itself. Any comments?
I think this is pretty straightforward.
Mm-hmm. Okay.
All right. Well, I'm gonna go. Everybody have a wonderful day and see you in 2 weeks.
Bye, everyone.
Bye-bye.